Hey everyone, the title of the video itself explains what the video is going to be about, and I'm sure you are going to realize its importance by the end of it. You are free to take screenshots of the slides and ignore my talk, but I would suggest you hear me out as I'm going to garnish these topics with some extra advice and tips as to how some of the answers must be written. So, without getting much into your nerves with such a long introduction, let's start. So the first topic which could be asked as a short note in exam is axilla. The boundaries, the content, the structures passing through the axilla and the axial folds with the diagram is important along with the clinical correlation. Then is the brachial plexus. It is the most important question and it's very scoring with all the root values and the branches. The linear diagram is important. Next are the five main nerves, which is the radial, axillary, median, mucocutaneous, and ulnar nerves. All these nerves, with their course, supply, the muscle groups involved, the clinical correlations are very, very important. Then are the wrist bones. The mnemonic for remembering the wrist bones will be uploaded by me soon. Is very important with all the diagrams and also the age of ossification, the primary and secondary. Then is the carpal tunnel syndrome. In this syndrome, which nerve is involved, you must know it, and I would be teaching that in subsequent videos. And the diagram is also very important. Then are the intermuscular spaces around scapula. What are the structures passing through it, which artery, which nerve, which vein, and the clinical correlation and the muscles forming those intermuscular spaces. Then is the cubital fossa. It's so very, very, very important. It shouldn't be left ever. The contents, the arrangement of the contents, the boundaries, what are the muscles forming the boundaries and borders are very, very important, and obviously including the diagram. Then is the anatomical snuff box. It is the most important part in the hand because an important artery passes underneath it, and it's very important for clinical point of view. Then is the extensor and flexor retinaculum. It is also a very important topic, and the diagram is also important. What are the structures passing above it and what are the structures passing below it, along with the clinical correlation needs to be mentioned. Then is the muscles of hand and their nerve supply. Which nerve supplies the superficial muscles and which nerve supply the deep muscles are very, very important. The palmar arches and the palmar aponeurosis are kind of important but can be left, but it's a 50-50 chance that these questions can be asked. Then are the palmar spaces. It is important for clinical point of view as any injury leads to pus formation. So we need to know the boundaries and what are the exact location and from which finger is it associated with. Then is the cutaneous nerve supply of hand. We do it in the OPD to check whether the nerves are working or not, or either which of the nerves are affected, uh, involving an injury. Then is the anastomosis around scapula and elbow joint. These are very important. Forget about any other anastomosis. You have to remember these two anastomosis at least, along with the diagram. All the muscles of the upper limb are very, very important, including all the superficial group and the deep group, along with the origin, insertion, nerve supply, and action. Then is the wrist drop and Erb's palsy. These are clinical questions, but are very much uh, probable as a question because these are encountered so many times in upper limb injury. Let's move on to the topics important from the long notes point of view. These are breast and shoulder joint. So, in breast, what all can be written in long notes are the location or situation and the extent of the breast, and what are the structures related deep to it. Then, the internal structure of the breast, like the skin, the parenchyma, the stroma, are important. The blood supply and nerve supply needs to be mentioned along with the diagram of the breast with the internal structures. The inevitable topic in breast is the lymphatic drainage, including the lymph nodes and the lymphatic vessels, along with the diagram, because these play a major role in the development of breast cancer and all the pathologies of breast. So, lymphatic drainage is always asked in the exam. And then is the development and the histology of breast. These are also an important subheading which has to be mentioned if long questions are to be answered. Then comes the shoulder joint. What type of joint is the shoulder joint needs to be mentioned. Obviously, it's a synovial type of joint and is a ball and socket variety. Then, what are the articular surfaces taking part in the formation of the joint? What are the various ligaments providing support to the joint? What are the bursa related to the joint? And the relations like the superior, inferior, anterior, and posterior. And also within the joint, what are the structures present? Then the blood supply, nerve supply, what are the types of movements done by the shoulder joint? The clinical part of shoulder joint is also important to be mentioned because various pathologies related to the shoulder joint, like frozen shoulder, dislocations, are always encountered in the OPD day after day. So, this was it from upper limb part of anatomy. The important topics for other chapters are also available on my channel's playlist. Do check them out, and thank you.